Soon be considered endemic in the U.S. Human cases of the potentially deadly illness have been reported in several states. And joining us this morning is Dr. Michael Scoma. He's a board-certified infectious disease physician. Good morning to you. Thanks for being with us.
Good morning. Thank you for having me.
Well, I want to start first for viewers who may not have heard of this before. Can you explain exactly what Chagas disease or kissing bug disease is and how exactly this spreads?
Yes, so Chagas disease is a disease that is spread by the kissing bug, the redovid bug. It's called the kissing bug because when it infects when it bites someone, it effectively bites them around the areas of the mouth while they're sleeping, hence the name kissing bug. And what it does following the bite, it transmits this parasite, which is called Trypanosoma cruzi, which makes its way into the bloodstream and then can set up shop inside the patient's bloodstream and set up and cause initially an acute infection, which in many instances is without any clinical sequelae and can be without significant manifestations for some time. The problem is that if undetected and untreated, it can lead to longer term issues of heart problems, cardiomyopathy, colon problems, and that's where we run into issues of mortality and things of that nature.
Yeah, some serious side effects for sure. We have obviously heard of cases being reported in multiple states right now. How concerned should people be here in the U.S. right now?
It's a legitimate concern. The majority of cases, given the increase, we have roughly about 300,000 cases right now as per CDC estimates. The majority of those cases are in patients or in people who are already infected, who are emigrating from endemic regions, namely Central and South America. However, the concerning aspect is that in some of the southern states in particular, Texas, Missouri, Louisiana, there's actual transmission going on there due to the increased migratory patterns of the bug itself. So these are issues where you can actually become newly infected in the United States without coming from an endemic area.
Mm-hmm. You talked about some of the symptoms and issues that this can cause long term down the line. What should people be looking out for in kind of the early stages for symptoms?
In terms of the early stages, it's complicated because a lot of times people do not have symptoms. Now, obviously, you can certainly be on the lookout for a nondescript looking bite that usually occurs around the mouth region or sometimes around the eye region, and it occurs while someone is sleeping. Sometimes you can have more of an acute phase of illness where, however, it's somewhat nondescript. Fevers, chills, night sweats, swollen lymph nodes. Sometimes you will get a localized swelling at the site of where the bug bit. However, generally speaking, it's rather nondescript, and you have to have somewhat of a suspicion prior to going for testing, which really early testing, detection, and treatment is really the only way that we have to prevent these theoretical long-term sequelae that can lead to lasting effects.
All right. Great insight. We appreciate your time this morning. Dr. Michael Scoma, thanks for being with us.
Thank you for having me.
7:38 now. Switch